So I guess to start, for people who are unfamiliar with your story into medicine, can you just give us like a brief overview of where you started at to where you're at now?
Okay, so I guess for me, I knew I wanted to do medicine from like sixth form high school time, because I remember growing up being like, what do I want to be? Because they ask you a lot when you're little, like, what do you want to be? I'm like, I was thinking about it. I think I went from like archaeology to like chemical engineer to there were like lots of things. But like realistically, I quite liked the idea of medicine, because you don't fully know till you're in it in like high school. I've had my mom and my like uncle and auntie. Some of them are medics, so I had a bit of experience into like healthcare. And so I was like, let me organize some work experience, or organize some work experience in sixth form, which kind of confirmed it to me. So there the journey began of applying. So I didn't apply actually till after year 13. So I applied in my gap year, which was a bit risky, but I knew that I was going to take a gap year. And I was like, okay, by that point, I'll have my grades. But some people might say that that's like one less year to do it. But I was like, I'll be fine. And so I applied then, and didn't get in. Because first off, more importantly, I didn't get the grades needed to apply to medicine. And so I had to think about it really, like, do I want to apply as a research candidate? I don't think I knew about grad med at that point as well. So I was looking at all my options. So I applied four med schools that would take research applicants, or said they would. And then my fifth choice was initially like anatomy and physiology course or something like that at the Uni of Manchester. And then I found out about this course at the University of Bradford called Clinical Sciences. And so that it was like a widening participation course that you could apply to medicine at Leeds, sort of like an internal application after to go in at first year or second year. And I thought, that'd be quite a good, like another chance to get into medicine. Because I personally thought everybody's different, but I was like, if I'm going to start a course, I want to finish it, except it's like an internal sort of application. And the clinical sciences course looked interesting as well. So yes, I applied as a research candidate and then didn't get any offers, surprisingly. And so, but actually I was really sad at the time, but I can look back at it now. But then I was like, but looking back at it, I'm glad things turned out the way they did. So applied then, got all 4 rejections from med schools, and then thankfully got an interview for Bradford, which I was really happy about, and then got an offer. So I started the clinical sciences course, and then year 1, so I was working towards applying to join year 2. And it was actually a really good course. The first year was similar to like a first year medical undergrad degree. So we did like all the anatomy sessions. We even like went to do into hospitals to like do like patient interaction. And then I applied through that way. And I was like, you know what, it's looking good. Thankfully got the grades needed. And then they tell you how to do the internal application. Got an interview, which was really good, but then didn't get an offer. And that probably sucked more than the first time round, I think, because I thought, oh my gosh, I've done everything needed, and it still didn't work out. I went to a point where I was like, I don't even want to do medicine anymore. What is this? I was like, I'm just going to do something else. So I had like my summer. So it was summer you had to apply. I had my summer to wallow a little bit, because I always knew, like I said, that I was going to go back into the course. I wasn't going to apply for new class or leave the course, because I joined the course knowing that I would be happy to do it anyways. And so had my probably about a month, where I was just feeling sorry for myself. Woe to me. Oh gosh. But you know, it is, everybody goes through things. And at the time, that was like a really big thing. But then thankfully, I was like, okay, you've had your moment. Now, what are you going to do going forward? So I was like, do my research. I was like, oh, you could do graduate entry medicine. This is a thing that can happen. And so actually from that summer, after I'd had my moment, I literally made like a Word document. I was like, these are all the graduate entry courses in the UK at the moment. These are their grade requirements. These are the admission tests you have to do. These, you know, is what they want. This, the grades that they want, all of that. And I was like, we'll see. But obviously this is 2 years ahead, 2 years before I would have to apply, a year or two. So starting second year. Actually, it was just a year before I would apply, because I applied in my final year, third year. So I said, I'd made this, kind of like motivated me a little bit. This is what I need to work towards. But at the end of the day, I was like, the most important thing is getting the grades that I need to be able to apply to grad med. So I was like, okay, let's just work hard this year, get all the grades needed. That year as well, I was kind of like arranging work experience, didn't focus too much on sort of entry, the admission tests or anything at this point. And I just basically enjoyed the course because, in first year, you know, everyone's very going for the same thing, you know, very focused. But when you're over that, everybody's like, all right, let's just, you know, chill out a little bit and breathe. So I actually really enjoyed that course. It was a really interesting course, got to do different modules, and it was a very good foundation for starting medical school when I eventually did. So third year came, I had work experience at this point. I updated my little Word document, just they keep changing things every year. So I was like, these are the requirements. And I kind of planned myself because I knew the UCAT, the BMAT, and the GAMSAT were the tests you had to do depending on where you were applying to. And I was like, you know what, this GAMSAT doesn't look great, you know, it looks like quite a hench exam. So I was like, let's see if I can avoid that for now. So I kind of planned it early and did the UCAT early on. And so I was like, if I do well in the UCAT, then I knew the unis I would apply to, and made my little, I made my little table. I was like, these are the UCAT unis. The BMAT unis, there weren't that many at the time, and I'm not sure whether it's still the same or it's changed. I think it was only like Oxford or Cambridge, I think, that were taking grad med, BMAT for grad med. And I was like, it wasn't really, they weren't one of the unis I was like super interested in, but I was also like, you know, wherever will take me, I'm happy to apply. So I was like, I'll give myself time, do the UCAT first in plenty of time. And if I do too well in it, then I will reapply. Not reapply, sorry, I'll take the GAMSAT and the BMAT if needed. And I've given myself sort of ample time to prepare for it. And then I also had the unis I would apply to if that was the case. So I'd done the UCAT first time around when I applied. And I just did like the practice question on the website because people were like, you can't really revise for it. So I did do the practice questions. I was like, okay, I'll do the practice question on the website. So did that, you know, went in. I think I got like 500 and something. And I was like, this is all right, isn't it? Yeah, it's not. It was okay. It wasn't bad, but it wasn't a competitive score. So I'd done like a bit more research at this point. So I was like, okay, I'd like to get, you know, above 700 if I can, but you don't actually need to get, you know, it's not necessarily that much. You can get higher, you can get a little bit lower and still be good. So second time round, I was like, okay, I will do the practice questions on the website, but I will also do a lot more practicing. And so I got like the it was UK CAT at the time. I know it's changed to UCAT now, but got the UK CAT, like, I think it's like 1,000 questions, or I think it was 300 questions like at the time when I was doing it. And I'm not that old, I'm making it sound like it's ages ago. But it was at the time when I was doing it, I got the book, and then I got the like a Medify subscription, like the online thing, and I just like practiced for that. I did a little, I'd say maybe a month or two, I would do a little bit every day. And then the week before I did like just focused on it basically. And thankfully got quite a good score, like 700 and something. And so I was like, yay, I don't have to do the CAS. I'm sure if I had to, I would have like gotten on with it and like prepared for it. But thankfully I was like, okay, don't have to do that. Apply to my unis. Thankfully got 3 out of 4. Yeah, got interviews at 3 out of the 4, and I kind of applied strategically. So I applied to 3 grad med and like 1 undergrad as well. And so I had like, the undergrad was kind of like my backup, but it's not really, because any like medicine course is great. So I did that. It was just more the length of time because I'd done 3 years already. Didn't want to do any longer if I didn't have to. And so thankfully got 2 offers from that as well. And then I got an offer from 1 grad med and 1 undergrad, thankfully. And so I went with the grad med, and yeah, I really enjoyed med school actually. And I'm now actually I just started GP training. So I'm a GP ST1. So I did F1 and F2. I did an academic foundation program after that. And then I took a year out, as you do, took an F3 year to kind of locum and travel. Coronavirus put a stop to the traveling bit, but it's all good, I was able to work more and kind of, do my bit. So that was good too. And now started training 6 months into training. So yeah, that's a kind of whistle-stop tour of my journey so far. I kind of like sped it up towards the end, but yeah, that's pretty much been my journey. I can go into like specifics as well if you want.
Yeah, that was perfect. I guess the first question would be, which universities did you apply for on your final attempt, and which universities did you get an interview and an acceptance from, just so the viewers can obviously piece it together?
Yes. So for my sort of grad med chance, so at final year, third year of uni, I applied to Newcastle, Imperial, Manchester for my 5-year, and Warwick.
Okay.
Yeah, so those were my 4. I got interviews from Imperial, Manchester, and Warwick. And I got offers from Manchester and Imperial. And then I ended up going to Imperial College, London.
Well, so it does seem like you sat the UCAT quite a few times, and I think it's a good point to touch on how you actually found the UCAT as you progress through, so you getting more familiar with it. I guess you mentioned Medify and the 1,250 word book. Mm-hmm. Is there any like particular resources you found helpful, or was it just those main 2 resources that you used to revise for the UCAT?
I guess those are the main 2 that I use. So the Medify subscription had loads of questions. So that would probably be like my main source of revision or practice, should I say, because you can't really revise for it. But the UCAT book, the UK CAT book, was useful in like going into like techniques, especially for like the abstract reasoning bit, because that was the one that threw me sometimes. I was like, how does this shape correlate? Look like random. And so we kind of went into like little tips and like details about how they do, and so that made more sense. And then doing that alongside practicing, and then of course doing the actual practice questions on their website gives you like a realistic view. But thankfully I'd done it before, so I knew sort of what it was like taking the exam under exam circumstances. So for me, it was just literally during the questions, because then they began to be like familiar in a way. So if I saw when it came up like in the exam, it was a bit like, okay, I've seen this before, because some things are similar, some things are different. So yeah, I think that was those 2 resources were mainly the ones I used.
Yeah, perfect. And I guess it's good to also mention on when you applied strategically, obviously you must have done something correct, because from the first time when you didn't get as many offers, and then you come out with 3 out of the 4 interviews. So I guess how did you find the strategic aspect in could you give like any tips on obviously applying
Mm,
strategically, how
yeah,
to apply your strengths, and obviously everybody's going to have weaknesses within their
yeah.
application. So how do you mitigate the effect of your weaknesses as well within
Mm.
your application?
Yeah, no, yeah. So it's quite important to apply strategically, like you say, because you don't want to waste an application. So I kind of, alongside my table of like all the courses and what they were looking for. So I kind of started with, okay, I had quite, sort of a wide range I could apply to because I was doing a science undergrad, and I know some places specify you do a science undergrad, some places take you whatever discipline that you've done. And so by the time I'd done the UCAT as well, I knew what scores to go with. Another thing I did actually was going on like student room and like new media medicine. It was at the time, I think, was what it's called. I don't think it still exists though. I tried looking it up the other day. It might be called something different. But like going through that was really useful to see people who'd applied, what grades they'd gotten, what their score was. And so I was like, okay, someone who has a similar profile has applied and been successful at this medical school. So I know I have a better chance. And it was a bit time consuming actually, because I was like scouring through it all. I'm sure they even have on the student room like a profiles thing where you put your, you know, your grades, where you apply to interviews, UCAT score. Another thing I did was going on a website where people had asked for like freedom of information requests
Yeah.
from medical schools to say like what was the average score of UCAT score for people who applied to your uni, you know, for this course. And so I looked at that and I was like, oh, this is a, you know, I've got a chance here. And I knew for Newcastle actually from that I could gather that my UCAT score was probably like borderline in terms of like getting an interview or not. It was above what they'd had last year, but from the trend, I saw that it was increasing every year. So I was like, but I
Yeah.
thought, you know, it's still worth a chance um, to go for that. And in terms of the grades that they want, you know, they say either 2-1 and above or having a master's before. I knew I didn't have a master's, so that's why I was like, it's really important to get the grades because that kind of determines most things. In terms of the interview style as well and what they do, I feel like I'd probably excel more on a, you know, the panel interview can be a little bit intimidating sometimes. So I applied to like a mix of things. So Manchester was like MMI is like a mini multiple interview thing. I don't know if that's what it stands for, but where you go around different stations. And I was like, okay, I'll apply to a mix. So I give myself, you know, a chance to see which one works best for me. Yeah, I think that was something I did different from first time round. I guess first time round I was limited in that I could only apply to places where that took recent applicants. But this time round I was like, okay, there's a broad range of things. Then I was like UCAT only, so there were only a few. Again, from that, I do think most of them still take UCAT. So again, it wasn't too shortened. And then for me, I was like, 4-year courses are more difficult to get into. So that's why I chose to apply to one 5-year course. It's still difficult to get into that, but less so, you know, just in terms of numbers. They have more places for undergrad in undergrad than for grad med. So little things like that was how I kind of targeted my application towards that. And even when it came to interview, like again, the student forums, um, yeah, student room, people would talk about like the interviews and the kind of questions that they ask. You'd have to like scour through it, but you would find it, and I'd be like, oh, so they asked that. They asked. I saw there that they asked the question about like organ transplantation for the imperial interview. So I was like, and then it came up in mine. So I was like, so things like that, just yeah, you have to put the time in and you have to do your research, but it pays off.
Yeah, of course. With especially with obviously now with graduate entry being such a bottleneck degree in that some UCATs are now asking, as you said before, some UCATs were asking like 700, 800 now.
Wow.
It's I guess that's down to the limited amount of places and the amount of applicants. However, again, it's trying to justify the choice of, do you apply for a 5-year undergrad or do you apply for a graduate entry? And I think speaking to people like yourself and the previous guests is that some people have gone down the 5 year successfully, and if that be worked on worked on the side or self-funded it, etc. Mainly due because it's less competitive to get in, and I think you do have an edge on every other student coming out, because you have the work ethic. Well, the universities know you have the work ethic, the degree, and the basic knowledge of what's going to be taught if you did a science degree.
Yeah.
I guess the question is how, moving on to your interviews. Presumably, the interview style has changed since you set your application, but were they all MMIs at the time? Oh, well, you said some were MMI, some were panel, and then others were like a mix. So,
yes.
I guess how did you find the MMI style of interviews? Because mostly now universities, are mostly MMIs at this point.
Yes. I quite like the MMI actually, because I felt like it would give you different opportunities to shine through. So let's say if you didn't do so well in one station, you could possibly make it up in the other stations. And having that one-on-one with someone I find it quite nice as well. But that's personally for me. I feel like I do well more on one-on-one, as opposed to like a huge panel. But again, I did that, and that was Imperial's actually. Imperial was a panel, and it still turned out okay, thankfully. But it could have also gone completely the other way, and then you don't have any other opportunity to show yourself. So I prefer, well, maybe not prefer, but I quite liked the MMI style, just because different things. We had like a group one, and then we had different, I think they asked me about complementary therapies and one. And so different chances, different kind of questions to be able to shine through. And I think you can prepare for it, just like with any sort of other interview style. And it, for some people, might be less intimidating, actually.
No, yeah, I totally agree. And I guess the flip side to that is when the students get the role playing aspect of MMIs, and I think that's what throws most people off.
Yes,
I'm guessing, how did you prepare for that? And is there anything you could like give on like tips wise on how you ultimately became like successful?
Do you mean in terms of like just specifically the role playing aspect, or this both?
I mean for both. Like most students have found ultimately struggle the most on role playing, mainly because you do need to know a bit of background information on, say, how to break bad news or how to let somebody down, etc. But I guess any tips or advice on both of them would be great.
I think for mine, I didn't have like a patient in there per se, or a role like an actor acting, as a patient. But they did show like a video where they were like a consultation, and they were like, make notes on, this is for one of the interviews, make notes on what you think went well, what you think didn't go well, and I guess more going through, like looking at resources, because now you can go on like online and find like med school, because what they're trying to simulate is like a med school OSCE almost. But I think they also wouldn't expect you to know detail about that, because that's why you're going into med school, to learn that, and keep learning that still, to be fair. And so I guess watching, if you go on YouTube, you might be able to find like these sort of simulated patient encounters on like med school prep or med school OSCE and videos, and read on like what went well, what didn't go well. Also going on GMC and like reading like some of the guidelines there. They've also got good case studies you can go through. So that's one way to prepare for it as well. Just practicing and experiencing it is the main thing, because again, they wouldn't expect you to be like a pro at it, but just to see that you've done a little bit of background reading. And it's almost a little bit like the SJT aspect, in seeing how you approach it. Are you like empathetic towards them, sympathetic, or are you a bit like, why do you do that? Look at it from both points of view, to be like, I can understand why, for example, this patient got really upset, but then I can also see it from the doctor's point of view, wanting to give that news that needed to, and you had to give it clearly, even though you knew it would upset the patient. But being able to do that in a safe space, making sure there are no distractions, things like that. So yeah, just going online, especially now that everything has gone online due to the pandemic. Most things have gone online. So yeah, just looking up the resources. The GMC case studies is a good place to go on. That's really available to everyone to look through. And to be fair, doctors even still use it now when we do like specialty applying to specialties, because we have to do exams as part of that, and interviews, because guys are never ends. Just keep going. But it's worth it. Don't worry, it's worth it. So yes, that's probably something I think might be helpful to do.
Perfect. And pulling from that, I guess it sounds like you need to know the basics of the background information on how to break bad news, but also you don't want to come off somewhat like robotic or reading a script.
Yeah.
So it's trying to find that. It's like a balancing act of trying to balance your knowledge and the procedures set in place, but again, not reading off a script, and ultimately not showing that attachment to that engagement, really.
Yes, and we know like breaking bad news is one that is an example that they would likely use at interviews. So trying to prepare for that, but then there might be somewhere you've not been able to prepare for, and they just throw you a curveball, and it's just how you manage sort of the whole situation. And there's nothing even wrong with saying, at the end of it, there's something I'm going to go and do some more research into and look into when I leave this interview as well. I don't think you would get marked down for that. I hope not, but
I guess getting into the nitty gritty of it now, like looking back, is there anything you wish you would have known before you began your degree at Imperial?
Anything I wish I would have known before the degree?
I guess that's with just like the application process as a whole, like anything you learned on the way to your degree at Imperial.
I guess I feel like I learned a lot from the first time round, through UCAS, and then the second time round through the internal application. So I really did my research and tailored my application. For example, on Imperial's website, they said we want the clinician scientists of the future, and I was like, well, I'm doing clinical scientist. Is that not, And so that was one other way I tailored it to them as well. Honestly, it sounds, maybe I need to reflect a bit more, but I think I prepared well for the application at that, that third time round technically, my final year uni application. I guess just don't be afraid to be yourself, and just be you, because I know a lot of people are I want to be what they want, but it's not, it's important to have those aspects, but chances are going on that journey, you will have the things they want in terms of your degree, the grades that you want, the extracurricular activities that you've done. So it's just about going there and showcasing that, because to have gotten an interview, you've showed, you've met that requirement already. So just being yourself, I think is quite important. So I don't think I would have done anything particularly different. I learned from the first time around not doing things because I feel like I'm a bit of a last minute mini, but that time round I did better than usual. I applied a day or two before the deadline, which is so good for me. So I think I improved, but yeah. If I think of anything else, I would this is going on YouTube, did you say?
So it's just going to be sent to the society members. It just publish it on YouTube and then send the link just because ease of access for all the members.
All right. If I think of anything, I will email you or like comment below if it is on there to be like, okay, actually, this is something I would have done a bit different. But no, nothing I can think of at this point.
Perfect.
Just enjoy when you get into med school. Enjoy the process and enjoy everything.
Perfect. And so you've been through your graduate entry course, you've been through your foundation training, and you're currently in your specialty training now. So I guess you've been through the whole process now. So have you found like any particular like myths or misconceptions through the process that are like stigmatized throughout med school, or just being a doctor in general, I guess?
I guess I don't know whether it was more like where I was surrounded, but like GP being a specialty wasn't like something I considered and something I felt like I didn't get as much of an experience of during medical school. It might have just been the way that my placements worked out, and sometimes hospital doctors view not all of them. People really are understanding of like what GPs do, but also quite a number are like, oh my gosh, just just the GP thing, but actually knowing that GP is a great specialty to consider and be a part of. And I didn't even consider that till later on in medical school, mainly partly because of, maybe it was me, but the voices and influences I was hearing about what it is as a specialty and my lack of exposure to it. So I'm just plugging GP over here, but it's a great specialty that gives you a wide variety of medical sort of experience and conditions that you see, and you see people in the community if that's something that you're interested in, but there's also scope to have a special interest. And I know GPs who do clinics in hospital. That was actually when I first started considering GP. It was during my obs and gynae placement in med school in 5th year. And I was in clinic with the doctor and I was like, oh, so what level are you at obs and gynae training? And she was like, actually, no, I'm a GP. I just have a special interest in this area. And I was like, you can do that? And that was literally like where it started for me. And people do that in all the like wide variety of specialties. And it gives you the flexibility as well if you wanted to do GP and then your special interest or something completely different. And so I guess that's the one thing, the misconception of like GPs and what they do, which was my experience. I'm sure it's not everyone's experience that I learned, going through med school. But also med school is hard, I'm not going to deny that, but also it's fun. Like it's a great experience. I feel like med school is like all the fun without the responsibility and also the exams. But you get through that part of it. So just enjoy learning, because I love learning, and I'm sure most people who are doing medicine do. They love learning too. So just enjoy that process of learning, get involved in like all that uni has to offer too, and
and I can totally sympathize with like why you chose GP. I guess my only distant connection to anything NHS is one of my distant family members being a GP, and having spoken to him, being in the profession like 40 years now, it's his reflection on obviously his time as a GP has shown like the requirement and how special they actually are within the community. Like it's something that's needed and sometimes underappreciated, but it's imperative that it is there. So I can totally agree with what you said.
Yeah, no, it's definitely like we're the gatekeepers, as they call it. You need hospital medicine, like definitely. Like I'm so grateful for hospitalists and surgeons and all the different specialties. But GP is it's tough and it's changing, but it's quite a good specialty. At least I'm still saying that now. I hope I'm still saying this years down the line, but I think I will, because GP gives you that flexibility to.
Yeah, for sure. And I normally ask this question to med students. But I guess what keeps you motivated through, obviously you've been through your degree, you've been through your foundation training. So I guess what personally keeps you motivated to ultimately pursue this as it's going to be a lifelong career for yourself?
I guess my one thing is like my love of learning. Like I love learning, so it gives me the opportunity to do that. The effort that it took to get to this point as well, just reminds me every once in a while that what it took to get to this point, and the fact that you are making a difference. You are helping people, and you can help people in a whole range of careers, but this is the particular career I've chosen to do that in. And you can make an impact with your patients on the wards or in GP surgeries. I think that's something that some of the things that motivates me to keep going, and the variety you see. There's something different and with what you see every day, and being able to integrate that with different things. So I've got an interest in research, which is why I did the academic foundation program, and then I'm actually my GP specialty training. I'm doing an academic clinical fellowship as part of that, which gives me a chance to do research. And you can, as well as being on the wards, through research, you can find ways to improve patients' lives and make an impact that way. And then you see that translated with clinical practice, because we can always find ways to do things better. Like we're doing well in aspects, in a lot of aspects, and there's always ways we can do it better too. And doing research gives you the opportunity to find ways that you can do that. And that's something else that keeps me motivated, knowing that I'm contributing, hopefully, to some way of providing better care in the future and improving on what we're already doing. So lots of little things keep me motivated.
I totally agree.
Well, food helps to going. Just little things like that. And sometimes, you just don't. You can't be bothered, and you just have your moment. Just don't stay there too long. Then keep going.
Yeah, I totally agree with what you just said, and even reflecting onto what my distant relative said. He said, "You're the only doctor that serves the community. You can see somebody as a child, and then 25 years later, you can see them as an adult coming in with their child. It's like, as you said, you're that gatekeeper for the community, and." Unfortunately, yes, hospitals are imperative, but you see that patient for 5 minutes and then you see another 50 after them. With a GP, you're so localized within that community that you get to see these people grow up. You get to see their children and hopefully their children. So
they call it like the birth to death thing, where you see people. It's the continuity of care, and in some ways that is going a little bit, but if it's something that you wanted to do, it still exists, and you can still carry on with that and be that, in a way, that pillar in the community, which is amazing. Some hospitalists do get to do that as well. Let's say some people with long-term conditions, they see them very regularly, so they get to see them through that, but it's in a different way than with GP. So we both have our different ways of doing things, but ultimately the patients always come back to you as a GP, which is one of the ways I think about it. And so, hopefully I'm still thinking this in a few years. I'm sure I will. You can ask me then when you're done.
I think one piece I'm really interested in which I discussed with him was where GPs are going. Obviously, everybody's probably experienced over the past year of GPs going online and GPs doing more telephone calls, if that'd be like face to face. I guess where can you see the profession of a GP going in the next few years? Obviously, you just starting out your training at the beginning of becoming a GP. You've got a lifelong career ahead of you. So where can you see the profession going? Like he gave me some examples, but I'd like to get your perspective on it as, I guess, at the beginning of your career.
It's quite a charged question, actually.
Yeah.
Like there are lots of like opinions about this, and I guess it's one to watch to see. With the pandemic, like you say, everything has gone online in order to and ultimately sort of ensure patient safety. Because you see lots of people as a as a GP, like the amount of people, and if you had it or one of those patients had it, the next
Yeah.
how many people you've seen, because they see loads of patients a day, you might be spreading it that way, and especially initially in that initial stage when there wasn't as much PPE. Now GPs are more so bringing people in, and actually there is some benefit to like telephone and online consultations. And I think it probably will stay even when things return more face to face as the majority of consultations. Because even like myself, I know there are some things I just like can pick up the phone and just be like, hey, can I I just need this or I just need that, and you don't necessarily need to see someone face to face, and that frees up more space to see the people who need to be seen in person. So that in a way that is probably, it's forced people to do that, and the benefits of that will be seen. But obviously having that fully the way you see patients is not also ideal, because as a GP you do want to see people.
Yeah.
And that's something I am worried about, actually, because at the moment I'm still in hospital, because you have to do, as part of GP training, you do hospital rotations before then going into GP, or as part of the training in general. And I actually do like seeing patients face to face, but ultimately I don't want to put anyone at an increased risk too. So it will be interesting to see how that will be. GP in the future, only time will tell. It is changing. It's changed a lot from what it was, say, 30 years ago. Like I'm sure your distant relative was probably telling you, if he's been in the game, as they call it, or been in the profession for like 40, 50 years. But I think it can be improved upon. It will partly be dependent on, where the NHS will be in many years.
Yeah.
In many years to come, and how that works out, because we are, our roles are determined by the NHS and the need. There's a lot of like more complexity in GP, which one could argue 10 minutes appointments enough for that. I know I, for one, enjoy spending or having the opportunity to spend time with people, with patients, and not have to necessarily like rush through it. But I know there's also an art to being able to get all the information you need in a short space of time, because you do need to see several people. You can't spend like an hour with one patient as well, except you pre-book that, or an acute need comes up. So yeah, I know there's going to be more sort of collaboration, with how things will be done. I did a GP job in F2 where there are different practices joined together in sort of like federation or super federations, however you want to call it, to be able to support each other to provide those services. You're getting more allied healthcare professionals in GP. They always existed, but I think that it's becoming more and more, like it's more normal to see like a practice pharmacist now. It's more normal. Some practices have counselors as part of their normal day-to-day. They might not be there every day, but come in a couple of days a week. I'm running different clinics. So yeah, it'll be interesting to see.
I totally agree with what you said, and some of the key points that you brought up is what he mentioned, in that almost he was like the commercialization. I think it's really interesting. I find it really interesting to see where GPs have come from to where they're going to end up, with obviously the inevitable, I guess, evolution of things being updated constantly. And he mentioned mainly like the commercialization, and I think you mentioned it as well, with obviously the collaboration between different GPs joining together as a partnership. So I hope it doesn't get too commercialized, as my opinion, but I totally agree. Like I think I think you both have like the same wavelength of where it's gonna go. So
yeah, I guess the NHS at the moment, there is a, that it can only get commercialized to a certain point, because at the end of the day, it's the NHS. It's a service, free for everyone to access, which is what it was started as. But like I say, depending on where the NHS goes, it will depend on where, I guess, GP will ultimately end up. But yeah, we shall see. There's lots more like nuances and lots involved with it, but we're not going to go into all of that now.
so I guess as your specialty as a GP, how do you find time for like rest and self care? If that'd be like, I guess you don't do so much like extracurricular activities now due to COVID, but I guess it spans all the way across your education. Of like your first degree probably wasn't as intense as your graduate entry, so I guess starting from them two, how did you feel the pressure of obviously trying to fit your rest, self care, sports, extracurriculars, if you want to call it, into your, I guess, day to day life?
Yeah. I guess it just takes like planning and organizing, but it can be done. Like, you might not do it so well at certain points, but overall, if you do it okay. I guess I'm someone that's very big on like self-care and like having a good work-life balance as much as is possible. Different seasons will bring different things. But I would always get involved in like societies. Heck, sometimes I think I'd get involved in too many things, and I'd be like, chill out. You've got a medical degree, you've got a degree to do. So in Bradford, I was involved in like Medicine Sans Frontiers and the student society there. I was involved in like the Christian Union. Heck, I even did like I was like doing Sunday school at church and like doing youth leading. Not necessarily all at the same time, but like different aspects. But like you say, with undergrad, you have a bit more time, so you could do that. But in med school, I kind of carried on with that. I was involved in gospel choir. I was involved with the Medicine Sans Frontiers Society, the Grad Med Society. First year, I like volunteered to be the year rep, which was very different for me. But I was trying to like push myself and do something new. And it ended up taking a bit of time, and I was still involved in church. I was doing like youth leading. I was doing too much at some point, but thankfully was still able to balance that with work. So as long as you plan your time well and what you give to, knowing that, okay, let's say we have our Christmas concert coming up, so we'll need more time to do that, so let me do work more so just before that, so it gives me, I'm freed up to be there as needed. And to be fair, having that, I feel also grounded me, because it just made you realize it's not all medicine all the time. Medicine is what you're doing, and it's an important part of things that you're doing, but you're also the sum of everything else that you do. And I made sure, I still was seeing friends and family, which was quite important too. And also having alone time, because I'm someone who enjoys my alone time. And so I would also give time to that. I'd be like, at least once or twice a week, I would have just an evening to just chill, watch some comedy and, get a takeout and just like play, listen to some music at home too. So that was quite important for me to do. So everybody's different. Some people can do more and still be able to manage that. Some people will have to do less and still be able to manage that. But finding what works well for you and not being afraid to say like no to certain things. Yeah. Sometimes I was like, I can't do this now, but I can work towards it and maybe I will be able to do it later. And then I was able to do it later, but knowing that I couldn't do it then was important. And so, yeah, saying no when to say no, which is difficult actually, to do. And also knowing when to be like, actually, I need to take a step back, even though I am doing these things, and just keeping that line of communication open, because you don't also want to leave people in the lurch. Just being like, actually, I need to take some time. And most people will understand that. Like, if you told them, in time, and like, you do have the moments where it's last minute, but there's nothing you can do about that, and it's usually not the norm. It tends to be more one-off. So yeah, just doing other things that you enjoy is important, because if not, you can get like an origin in the medicine bubble, which is enjoyable, but too much of anything can be not great as well.
Yeah, I totally agree with that. It's trying to not get blinded on everything around you, and I guess it's the saying of run your life around medicine, not like medicine run your life. In that it can, especially with graduate entry, it can be somewhat overwhelming sometimes, and it does come across that way. And I think it's even more stigmatized with these medigrams or these people doing 100-hour work weeks, and it does get stigmatized, but I guess it's just trying to find that time for self-rest care and getting yourself to, well, almost force yourself to spend that time, because ultimately it'll prevent that inevitable like burnout, fatigue, etc. I guess the important question at the moment with these students, well, applying this year now, students are really struggling to get work experience, and say somebody that's in the field, is there any like tips you'd give to these students to obtain this work experience? Obviously some universities require it, say Warwick, he require that 70 hours, so I guess it's a bit of a difficult question, but are there any like tips or advice you give these students who are trying to even start out and getting this work experience?
So it's tough at the moment. I can't even imagine how it is, because I was actually talking to someone who was like a week or two ago who is thinking of applying to medicine, and they had the same question. They're like, I'm finding it quite hard to find any work experience. And I even like got in touch with people that, like my GP supervisor, to ask for advice about it. And unfortunately, just with the case of being in lockdown, it will be tough at the moment. Hospitals and GPs, mostly probably 99.9, will not be taking people on. Hopefully the universities will understand this and be a bit more lenient. I think that's a reasonable assumption, but also get in touch with them to find out, like, this is the situation. And I think most will come back and say, actually, we're going to be a bit more lenient. I think keep trying. It might be that now at this point you can't do it, but hopefully if things settle towards the summertime, it might be something that can be done. So if you're applying now, just keep applying to loads of places, and being like, if I can't do it now, please let me know if it comes up later. Most of these places will not, so because they have a lot going on. So you yourself contact them again a bit later on down the line, say June time, when I'm hoping things will be a bit more better. But you just never know with how things are going at the moment. Using online experiences, a lot of places are offering online experiences. I know my trust has even been like, we're trying to find a way. They contacted different doctors, and they sent out an email to all of or quite a few of us, to be like, how can we find a way to help work experience students, because at the moment we can't really have them in hospitals, but we still want to be able to provide them with this experience. So a lot will be providing online seminars or Zoom sessions you can attend, or online courses. The RCGP had one, I think over last summer, where you could do like an online sort of experience, which work experience, and it would count towards your application as having done that. I think they've sort of shut it down for now to improve on it, but I suspect it will be coming back again. And I hope other sort of organizations will also do a similar thing, to be able to look at work experience. YouTube, it sounds weird, but YouTube is a good way. Either seeing people like what you're doing, like, this is great. People can reference this and be like, I've listened to other people's experiences of what it is working as a medic or as a medical student, being a medical student, I've been able to I've had to adapt, given the circumstances, and gain that experience in other ways. Some doctors even like do like a day on the ward thing. So even watching that and seeing how that is would be helpful, and you could reference that and say, I've watched this and reflected on it, because it's not what you do as well, it's what have you learned from it. Don't you say I did, like, even if you did like a week work experience and you were just like, I did a week in this specialty, it's like, no, what did you see? What did you gain from it? How has that made you gain more of an understanding of what a medical or healthcare career involves? So it's like quality over quantity a lot of the time. And it also doesn't have to be specifically in a hospital. There are a lot of like great volunteer organizations still taking people during the current situation with the lockdown and the ongoing pandemic. So getting in touch with those organizations, the Royal Voluntary Service, they sort of provide services for older adults, people with complex health needs, and you could volunteer with them. I'm not sure whether hospital volunteer services are still ongoing, but it's something to look into. You could get a part-time job that way,
Yeah.
You have to be there. And they can't say anything, but obviously you've got to balance that with the work that your schoolwork, because you don't want to like do that and then not get the grades, because then you're left with another problem to sort out. So you've got to be ingenious about it and like kind of adapt to it, because at the moment most places aren't taking, I know it's not what people want to hear, but most places aren't taking anyone on at the moment, but hopefully this will change in a couple of months. So keep asking, maybe like keep emailing every couple of months, to be like, hey, has the situation changed? And sort of watch how the situation is with I guess just keeping up to date with good news resources and things like that, to be like, actually things seem to be settling, and with the vaccination rolling out and things, although that still doesn't stop you from spreading it. So that's also another thing. But hopefully at some point things will get a bit better. But just keep trying, I would say, and try and find different ways to gain that experience.
I totally agree, and I guess it comes down to just being proactive. And I guess just to mention a few more organisations, that St John's Ambulance is currently offering, I guess anybody that has a medical degree will have A levels or equivalent to give the vaccines, to be a volunteer vaccinator. Like some of the onlines, like Brighton and Sussex or the Medic Polar, have been very useful online resources. Like they've done a day in the life of working in a hospital, etc. So I do totally agree that there's resources out there to be proactive. Like even if that's working in the hospital, even though I've currently been put on hold at the moment because some universities do require you to have that patient to patient contact, but they are still offering you to go in and do non-patient to patient contact roles. So I do agree with that. It's just trying to be proactive in your search, and I guess it's ultimately showing that you've done something with your time, because
you tried,
yeah. If they just see you doing nothing, then they say, well, these other 10 people have at least tried to get this work experience, if that be online or had a part-time job. They can still reflect on that, whereas you just have to reflect on the time where you've done nothing. So
yeah, it's definitely still trying, and like I say, I hope universities, med schools will take that into account with everything at the moment, and just drawing on sort of experiences you might have had in the past that you may not think are relevant, but they might be, because at the end of the day, it's what you've learned as opposed to what you did so much.
I totally agree. So I guess talking about, obviously you've gone through med school and we've spoken to multiple like med students now. What does a day in the I guess, a week in the life look like as a foundation or like a specialist? Because we haven't really had so much of an insight on what actually happens post graduation.
Okay. If you wanted as well, like later on, I could go into it in a bit more detail. But generally, once you finish, you apply in final year. You apply for your foundation job. So that tends to happen around like October, November time, depending on whether you want to do like an academic job as opposed to a foundation only job. So you apply to that. By March time, you tend to know where you're going beforehand for some jobs, and you get a bit of time in the middle. It's been different with the pandemic at the moment because last year students started earlier and came into hospitals to help out, which they actually said was useful. The ones I spoke to, anyways. So you start your job. Induction is around the last week of July, and then you start on the wards, fresh faced. First Wednesday in August tends to be your first proper day on the wards, and hopefully you'd have seen this during med school. Again, you don't fully get to till you're quite in it as well. So a typical week would be, they call it like jobs, and I know as a medical student I was like, what do you mean by jobs? But basically you have to like organize things for patients on the wards. It will depend what specialty you're working in, whether you're in the community, whether you're in hospital. But you would sort of take blood, you would organize scans. If someone was unwell, you would review them to see sort of what happened. Let's say they spiked a temperature or their heart rate went down, or they were complaining of chest pain. You would review them, use all the knowledge you gained in medical school to be like, okay, this is what I think they're having. This is sort of like my management. But you would, as an F1, they don't expect that to all be on you. You would get senior help as well, and they would sort of work through that with you. They expect you sometimes to have done the basics, like taken bloods, sent off blood cultures, and then be like, this is what they complained of. This is what I found from the history, from the physical examination. These are my differential diagnoses. This is what I've done so far. Please, can you come see them? Or is there anything else you want me to do for them in the meantime? But if it's something acute, you might have to like put through. Some people have had to do this, like a cardiac arrest. 2222 tends to be what it is, Plus, you're not alone in doing that. You usually have like nursing staff, healthcare assistants to sort of help you with that, or even senior doctors on the ward at the time too. So you might not have to, it sounds very like, Mary cardiac arrest, but that doesn't happen a lot. No, it shouldn't, hopefully. But yeah, so that would be like a typical day. If there's time in a week, let's say when there's a lot of you on the ward, sometimes you can go to clinic to sit in with consultants as they see patients. You speak to different specialties to get them to review patients, if there's something you particularly want to seek advice from. So it's quite varied. You might be based on one ward, or you might have patients split across the hospital, so you might be going about. And then when you're on call, you might cover a couple of wards. And when you're on nights, you usually cover a couple of wards. So you do like the jobs that need to be done, like I mentioned before. So yeah, it's quite varied. I'm sure I've missed out some things as well, but usually it will depend on the specialty you're in. Some specialties are very much more senior led per se. So I've just done pediatrics. I'm finishing off my 6-month rotation on pediatrics. Obviously, little people are a whole different ball game, in my opinion. But like, you are able to do again, you've learned that knowledge through medical school, but you're able to ask for advice from seniors, because there are some things that will definitely need consultant or registrar input, because you've got the foundation doctors and you've got as an F1, you are in old money, as they call it, like a junior house officer. Then from F2 to about CT2 or ST2, depending on what specialty you're doing, you're the SHO, senior house officer. And then from usually ST3 and upwards, you are a registrar. And then depending on what specialty you are, some specialties take longer. You have to be a registrar for like 8 years or 10 years. Some places it's 3 years, like GP, or some other places it's like 5 years. So you're a registrar up to that point till you sort of complete your training. They call it CCT, and then you become a consultant. But just going back to F1 and F2, you usually rotate. You do 3 specialties every year, 4 months, 3-4 month specialties. You get a wide variety of experience. You can usually rank and choose that when you are applying for jobs as well. So if you're interested in, say, obs and gynae, you could choose to have an obs and gynae job in there too, so that you can gain that experience and be like, is this really what I want to do? But yeah, there's a lot more that goes into it, which is why, like, hopefully the people who do videos about it is useful, but it can be a bit tricky again, because you have to like gain like, you know, patient, you have to ensure patient confidentiality and all that. But it's one of those things that, yeah, it's hard to describe. But I hope it's been useful and I haven't said too much.
No, I guess it's good to. We've had up to like 20 people on at the moment, and most of them have been med students, like first, second, third years. So it's good to get the look of what it's like after. And I think you've explained it very well in that. Just to summarize, you don't stop learning. You don't stop sitting exams. You don't stop having interviews. It's just a constant process of ranking up, if that's the right way of sitting those exams and ultimately progressing within the ranks of the NHS. So I guess with you picking GP as your specialty, what's your vision going into the future then? Like, where can you see yourself in the future?
Okay. Just before I say that, I also forgot ward rounds are an important aspect of doctor life as well. So you do ward rounds for the first part of the morning where you're writing in the notes, and that's where you get the jobs to do. Because then you're like, oh, this person seems to not be doing as well. I'm gonna do bloods to see how things are looking, things like that. So park that to the side. It's like almost like I'm in another interview, right? But where do I see myself? I'm doing the academic clinical fellowship in general practice. So I do have this interest in research, like you say. And so my training is 4 years instead of the usual 3 years, because I've had that year added on to focus or to dedicate to research. So I will hopefully get through that. As part of this fellowship, I'm getting sponsored to do a master's, which is really great. So I will be doing, well, I'm hoping to do, I've applied for it at the moment, a master's, MRes, would you say, in public health. So that's one of my sort of interests. And I'm interested in like older adult care as well, and global health, and just integrated like whole person care, as they call it. So I will hopefully do the master's alongside my clinical training, get some, work on research through the master's and sort of outside of that as well. And then qualify as a GP, hopefully work in a GP surgery, but also I'm possibly looking to do a PhD in the future, as long as I don't completely 4 years and be like, actually, I'm done with research, which is also an option, but so far that's not how it's looking. So yeah, I'd hopefully do like a PhD if I find like a topic that's really useful and that I'm really interested in, and that will bring, some positive change and improve health in some aspect. And hopefully either doing GP, still being a GP alongside that, because I do want to still continue clinical practice, but also doing that research with it. Maybe getting global health involved in global health in some aspect. I'm not too sure at the moment how that will pan out, but probably for the next 5-ish years, I'm looking at completing GP training, completing my master's, and I'm getting involved with research, and maybe hopefully applying for a PhD, and then from there we'll see what happens.
Yeah. So I guess some students would like to know, with obviously you completing your degree, when ultimately graduating from medicine will send you anywhere from Edinburgh down to London because it's so competitive. Most students will go anywhere that accept them.
Yeah.
So within your specialty, from what I understand, you get to apply to like a certain area where you want to study, or you get to apply to a certain not a specialty, sorry, a certain area where you want to study. Obviously, London is most likely the competitive, the most competitive, and then you get to apply in different areas.
Yeah.
So after you've completed your foundation training, what happens then? Do you just get I'm guessing here, but the same option of you get to apply anywhere across the country, or is it more so you stay within that localized area of where you did your foundation training?
No, so it's basically similar to when you're applying for a foundation program. So you would rank, it's split into deaneries, they call it, usually by location. So you've got Yorkshire and Humber, which is like Leeds, Sheffield, York, Hull. And then you have like Northwest, which is like Manchester, Liverpool. And then you've got, London, which is split into, depending on the specialty, it can be split into, London itself can be split into different sections. But you will apply, it's basically similar to that. You apply to the area, and then when you rank it anyway, so you apply and rank all the different areas. In specialty training, you have a bit more choice. So you can almost be like, actually, I'm not interested in going to this area, so I'm not going to rank it, or I'm not going to include it. For example, applying to the academic one, I could have applied to all the different locations, but I was like, actually, I only want to stay in a certain area, so I'm just going to apply to these areas. I'm not too sure how the different other specialties work, but I know for GP, it's applying to the main, you apply to sit the exam, like the entrance exam, almost another exam. And after you do that, you might go straight through to the ranking process, or you have to do like an interview, and you do the interview, and then based on that, you get like a score or a mark, and you rank where you want to go. But yeah, you can choose not to rank places.
So, and I'm guessing when you mention like Northwest, you just pick that region and then you're allocated a spot from, say, Liverpool to Manchester. You just get given a spot at a hospital or a spot at a GP within that specific area, or do you get it like more localized? So, say you wanted to do West Manchester, East Manchester, or the outskirts of Liverpool, etc.
Yeah, so I rank Northwest. This is more from my GP experience applying to GP. And then when you get that degree, you then rank again.
Oh, right.
So that area is then split into different schools. So, for example, you can have Central and South Manchester, which is one school, which is a particular set of hospitals. Then you have like Salford and Trafford, which is another one. Then you have Pennine, which is another couple, which tends to be North Manchester, another cluster of hospitals, which tend to be in the area. If you're interested, if you go on the website, they kind of split up the map so you can see where Northwest then splits further. And there are so many schools within Northwest itself. Then there's like Bolton, for example, that's a different school. So you basically then rank again with schools you want within that area. And then you get, based on scoring, you get allocated either your first choice or your second choice or third choice. So yeah, it then gets split further. So the country is split into sections, and then those sections are split into sections.
Yeah. That's perfect. I think you summed that up very nicely, and I'm sure that'll, I guess, not set a lot of people at ease because they've got a long way to go.
Yeah,
but I'm sure you.
Further, to be fair, yeah. Maybe when they get like closer to the time, it'll make a bit more sense.
Yeah, I'm sure you've broadened their knowledge on what the application process is like further than obviously just even my knowledge, because I just thought you pick that area and you allocate a spot. So thank you for that.
No, it's partly based on the score that you get get allocated.
I guess for future medical students watching this video, are there any like golden piece of advice. I normally ask going through the application process, but I guess just becoming a doctor in general, obviously going through your foundation, your specialty, just any golden piece of advice going through the, if you want to call it the life as a doctor, or becoming a doctor.
Yeah. I guess enjoy the process because it goes so quickly. Like I'm like, how am I already at specialty training? I was crying about not getting into medicine. What's going on? But like the time literally goes so fast. So enjoy it. Learn as much as you can. I know we have to pass exams too, so we have to revise for that. But if you find the interest that you have in it, it helps the process a bit more. Get involved in extracurricular things. See your friends and family. It helps to keep you grounded, even if it's virtually, which it is at the moment. It can really help to keep you grounded. To try to have that balance of work and life as well. And it will be tough, working as a doctor, especially starting off, but don't be afraid to ask for help. I know there will be some people who seem more scary to ask for help, but it will be better for you, for your patients, if you're not afraid to do that. And it's up to people, doctors as well, to be approachable so that people aren't afraid, or your colleagues aren't afraid to ask you for help. So don't be afraid to ask for help, not just from doctors. Like nurses know a lot too, allied healthcare professionals, they know a lot and can be a good source of knowledge. But ultimately, one of the things about doctors, that decision is yours. That's one of the things. You are involved in that decision making aspect, but you're not to do that alone. And especially when you've just started off, you may not have all of the expertise. You might have the book knowledge, but it's a whole different ball game when you're in the situation and it's all stressing you and you're like, this person is so don't be afraid to ask for help. I think that's probably one of the main things. And even as a doctor, it can be so easy with crazy shifts to not do anything outside of work, but it's so important to still do something outside of work, even if it's just exercising or going to a class or even if it's just one other thing you do that is not medicine, playing on sports, going to a choir, you might not be able to make all of it because shifts are crazy, but try to keep in touch with that because it will really help you to de-stress as well. So I think that's
perfect. And I guess finally, looking back for somebody starting their first day at Imperial, what would be your take-home tips for that student?
Yes, first day it's all exciting, everything new. You won't be able to take every single thing in, so that's okay. So if you need to go back and refer to the resources and ask again about it, that's absolutely okay because there's a lot of information to take in. And if it's grad med as well, although I'm not sure whether Imperial still has their grad med course, so that's something to look into because I know that they've been changing it and pausing it and all that. But for anybody starting like a new course, don't be afraid to refer back to information or ask for help. I guess get to know the people around you, find your tribe, as they say, because they will be your support through it too. But don't feel too much pressure about it all as well. I've said it so many times, but just try to enjoy the process. It goes so quickly. Goes really quickly. Try and get as much as you can from it, but not all at the same time.
Perfect, thank you. And again, I'd just like to say a massive thank you for taking that out of your evening to come speak to me. It's been a real privilege to see somebody actually start at the same point that many of us are currently at, and ultimately see how you've progressed through your degree, through your foundation training, and now to your specialty. And it's really good the insight that you've shed on not to get bogged down on the application process. It goes through so fast, and I think your experiences and your points that you made will be really valuable to the people watching this. So thank you.
No problem at all. Thanks again for having me. And if I could just say like one thing as well, I know definitely medicine is great and definitely still apply and go for it. But I had a plan A2 slash plan B, whatever you want to call it as well. Because like I said, like I think a while back, there are many different careers that you can like help people in as well. And so I was like, okay, if this doesn't particularly work out, this is something I would really love to do as well. But you don't have to think about that now because you're still applying and you're gonna get it. But it's also good to have that in the back of your mind as well. Like there's so many amazing people across different careers that I've spoken to and interacted with, and within healthcare as well. So there are many, many ways to make a positive difference in people's lives, including medicine.
Yeah, and I'm sure. Well, it has come across that way in that you really do seem caring, and you want to actually progress into medicine. I'm sure that stems across the NHS, and that's why it's such a valued profession. So I totally agree with that. And I guess finally for the viewers out there, is there any way that they can get in touch to ask you any questions or ask any further any further questions on what we've talked about?
Yeah, sure. You could email me, Dr. Efia, EFIA @gmail.com. I'm also on Instagram as Dr. Efia, and I'm on YouTube as Dr. Efia. I've got some videos there. I've not posted in a while. Life is crazy, but I will try to be posting more, especially now in this time that may be where people may potentially be getting more source of information. So yes. Oh, I think I'm on that as well, but I don't really use Twitter. But
all right, thank you for your time again, Effie.
No problem. Lovely to chat with you, Aaron, and all the best. Did I say your name right?
Aaron, yeah.
Right at the end of the conversation. Yeah, lovely to chat with you, and obviously you can get in touch as well with anything. I'm sure you'll do great though. I mean, you're good at that.
No worries. Thank you again, and
have a good
enjoy the rest of your evening. All right, take care. Bye.